a little place called Hope. Maybe you have all heard about it. It's the opposite end of the country, and it's in Hope that I really was exposed to wood ticks. And when I first started my first case, this fellow was at an institution, and my medical student had picked up this perfectly round circle on the leg. It turned out to be Lyme disease, and it was one of the rare cases when the ELISA was positive. The ELISA, as you know, is notoriously negative. So we treated him with 3 weeks of antibiotics, and he was cleared. This is the only time it would work. They say 30 days, that's the time, right after the infection. The second case was a fellow who went to tree planting, and at 8 o'clock in the morning, he went to work. At 10 o'clock at coffee break, he noticed an itching rash. And the first aid man took a pair of latex gloves, turned it counterclockwise, and he was able to get the tick out. I saw exactly 48 hours later, another perfect circle. And when you see that perfect circle, you take a picture. Because if you don't take a picture, you haven't got nothing to show me or email me. And if you do have a photo you want to send me, I'm available at any time for free consultation. If you want to discuss your case, I'm free at my office number. I'm available for your doctor if your doctor's going to treat Lyme disease. And there are more and more doctors available under the radar. None of them want to be known as Lyme literate physicians because they're afraid of their peers and their college, which is very unfortunate because when I lectured at Van Dusen Gardens in Vancouver, there was 10 doctors, and each one said one thing: please do not tell the college that we were here. Which is kind of sad because this is Canada, and all they were doing was educating themselves. But nevertheless, right across the country, most doctors are afraid to treat Lyme disease. So if you have some questions about it, I have a pamphlet back there. You can phone me anytime if you want to talk about your condition. And it's free advice I've been giving for the last few years because the college will not allow me to have a license. So I've been talking to the Manitoba government, and I've been there 7 times now. And if you look at this picture, you can see that right across the top in the Arctic Circle, across the mainland, continental Europe, there's a line, and that is the Arctic Circle. It comes over here, and all of a sudden the ticks decide they don't cross the 49th parallel, right here. The only reason that this red here and here is because I've been practicing Lyme practice, and it was sent to the American labs. It was the same here. Several doctors here are using the American labs, and therefore there's 2 red spots. If you go by the Canadian stats, you have a solid line right across here that says there's no Lyme in Canada. They don't have the right visa, it's a common joke. But look at this. Look at this border here. The Americans will admit they have Lyme pretty well right across the United States, including Alaska, which is more northerly than most of Canada. For this, I'm called a zealot, incompetent. I've got to be careful how I say incompetent because one time I said incontinent. Well, the thing is, you've got to be very careful because incontinence and incompetence and incompetence and impotence are all sort of over here. Anyway, you see that if you feel that I'm wrong in what I'm showing you here, then you let me know. Because I'll defy any medical doctor to prove that I'm wrong. Because the college will call me all sorts of things. Zealot is a real one, a real good one. I just feel I don't know what I'm doing. So their philosophy, as you know, the IDSA guidelines say 30 days is all you need. Well, in one of my studies, I was able to take a 1-month study of IV therapy, 2 months of IV therapy, 3 months of IV therapy, and the first group, 10% improved with a 1 month of treatment of IV therapy, and all these were prescribed by 11 separate infectious disease doctors. The second group, 50% improved, and again, these were all prescribed by infectious disease doctors. The third group, 3 months. 80% improvement. Quite a marked response, which nobody can deny. And if you look at our website, it's on, those graphs are right on there. But I cannot publish the names of the doctors, of the infectious doctors who I had sent to for these treatments, because they're all scared of the college. I could not get one of them to support me at the college level, despite the fact that these stats proved that I was right. In this setup, which was presented to the Manitoba government, the common denominator carrier is the deer lice. And here you can see all of North America is literally covered with this deer lice. And it's got the spirochete living in it. The veterinarians will tell you, every province in Canada and every state in the USA has been found to have animals with Lyme disease. So you can see the source is everywhere. Except in Canada, again, it stops at the Canadian border. And we, the physicians, are at fault. I'm afraid to say we are the big major block as to why you cannot get treatment for Lyme disease in Canada, because the doctors are all petrified of the college or their peers who will criticize them. And what happened to me was a bad example, I guess, that I lost my license. But in a way, it has really put me in a position where I can come out and talk to people, such as yourself. And this is, I was here last month, and I had a tremendous turnout. But the biggest advantage for me to come out, I had 2 doctors phone me from Fredericton, where I lectured last month, and they wanted to know how to treat Lyme disease. And I had a call this morning from a doctor here, also who had attended a meeting. I didn't know he was there, but he attended a meeting and was quite convinced that his patients, several patients, had Lyme disease, and I spent some time this afternoon talking to him about his cases. And he was very most happy, and I'm sure he's going to get at least 2 out of 3 people back out of their wheelchairs. So it's a very difficult situation to be in when you want to treat and you can't. So with my free time, I don't have much of it, but I do give lectures to the naturopathic college medical students, both in Vancouver, and I have a contract now with them to give lectures about Lyme disease. They're so convinced that I am correct. And their college president actually attended my lecture. And we have worked on patients together, and he was amazed about the response we got. They're allowed to prescribe in BC. I went to Toronto, and I gave them the same lecture, and they videoed my lecture, and they're going to show it to medical students and give it to family practitioners in the naturopathic field to use. I am not a naturopathic physician. I was brought up evidence-based medicine. And that is how I treat, and that is how I will recommend to your doctor if that is your wish. And if it's a possibility, you can always phone me. I don't charge you for anything. It's something I'm doing because I can only do 2 things. Sue the college, like my 2 colleagues did, and they spent over $1 million each. I don't want to do that because I'll never win. It's like suing the government. You can win, appeal, win, appeal. And this has happened in 7 years to Dr. Charlie Jones, who I've got to know, and we worked together. And he was a pediatrician who helped me when I first started my Lyme practice. But he's fighting it because he says his fight is my fight, everybody's fight. Every patient with Lyme. Now, what are the stats? The Americans are willing to admit that they report about 25 to 30,000 every year, serologically with our straight ELISA test. If they're picking up 50,000 cases, they say multiply by that 10. That's 500,000 cases per year in actual practice. Because they're willing to admit that it has to be multiplied by 10. So if we have 500,000 in the States, traditionally any doctor will say 10% would be in Canada, which is 50,000. In other words, there's 50,000 Canadians suffering from Lyme disease under the guise of MS is one of them. MS and Lyme disease symptoms are very much overlapping, and it's the #1 diagnosis next to Lyme. But there's other problems as well: chronic fatigue, fibromyalgia, depression, ALS, Parkinson's, Alzheimer's. To talk about Alzheimer's, I have a classmate, Dr. Pat McGeer. He's a classmate, and he does research at the University of British Columbia. He took 3 patients who had a diagnosis of Alzheimer's, and when they died, he took their brains, and he was able to grow the spirochetes in a solution called the Balfour Stoner Kali liquid. He actually got these spirochetes growing, and he was able to reproduce these in deer mice. So this confirmed what I had been saying all along, that Lyme disease is not a syndrome. Chronic Lyme disease is not a syndrome, it is an infection. And I've shown that to everybody. I've shown it to the province of Manitoba. They have their eyes open, and they're having me talk to the doctors, the infectious doctors, in March. And if I don't succeed, I'm going to make a motion that we protect their doctors like they did in the States. 5 American states now, Connecticut, California, Rhode Island, Massachusetts, New Hampshire, and I was there in New Hampshire 3 months ago, and I made a mistake there. I wore my Canucks jacket. And when they saw me, they said, "Hey, take that jacket off. This is Boston Bruin country." So I took it off. And anyway, my presentation, I had a picture of Bobby Orr, my daughter, and my 2 sons, at a hockey school, because he was teaching and I was the team physician. And they said, "Oh, you know Bobby Orr?" I said, "Yeah, we used to go golfing and fishing and drinks after an evening of educating students." And he said, "Okay, if you know Bobby Orr, you can wear your jacket." That's the truth. That just happened a few months ago. Anyway, the situation is very sad when the doctors cannot treat Lyme disease. The 2 doctors in Winnipeg I was using, they suddenly stopped. And so the doctor, or the MLA, for assessment said, "Well, why did they stop?" I said, "You ask them, because if I say it, it's going to be biased." So he asked them. One of them said one thing, "I'm too busy." The other one said, "I'm afraid of the college." He was not afraid to say it. At least he had the guts to stand up and back me up on what I'm doing. But he was the only one. But he still won't treat. The provincial government has told the doctors that Lyme disease is a clinical diagnosis, which I have been condemned by my colleagues for. As I said, I've taken 3,000 patients personally. Most of them, I'd say 2/3, but 2,000 of them enjoyed a greater quality of life. 28 were taken out of permanent wheelchairs. Okay. And I was condemned for making people better. This is the only country that probably happened. But the biggest thing, too, is that the naturopathic physicians, 35 of them have said, "Okay, we're going to work with you." So in BC, we have an advantage. And I'm hoping you people will push your naturopathic physicians to the point of getting their prescriptions as well. And they will be prescribed. Okay? I'm not saying everybody should get this treatment. But if you want my free advice, I will give it to you. And we can at least consider it or eliminate it as a possible diagnosis. Checking, it's okay. Now, I should mention, I mentioned that MS is probably the closest thing that resembles Lyme in symptoms. There's strong overlap. There's no getting away from it. Anybody will tell you that MS has risen dramatically in the last few years, and so has Lyme. So how many of these people are Lyme? And how many people are MS? We don't know, because the tests are not definitive. By far. Our ELISA test is just not, well, it's criminal, what the doctors say. That you don't have a positive ELISA, you don't have a history of a tick bite, or a target rash, you don't have Lyme. It's crazy. The nymphal stage of a tick is the size of a dot. So if you were bitten by a nymphal stage of a tick, you wouldn't even know it, and the size of the inoculum is so minimal that your target rash is like a little dot, and you wouldn't even know it. So I'm hopeful that there will be a change soon, so that the treatment of Lyme disease will be under protection by law. In other words, if the doctors can't get together, and it's all our fault, we're not getting together, that we've got to get the laws to protect the doctors who want to treat and diagnose and eliminate it as a possibility. Because as far as I'm concerned, there's 50,000 people in Canada suffering from Lyme disease. It's hard to say, but the stats that don't lie. Americans admit 500,000, you've got to accept 50,000. And yet, the actual report is anywhere from 2 to 6 per province per year. And each province is about 10 times the size of Maine or Minnesota, you name it. We're 10 times the size, and yet our figures are only in single figures. It's really, really sad. It's criminal what you people are being told. Okay. 2 minutes. I like to tell a little joke. This lady had convinced she was at Lyme disease. She had diarrhea every morning at 8:15, like clockwork. 8:15, no matter what you took, Calpectoid, Emodia, well, strawberry, you name it. 8:15 diarrhea every morning. So she went to the doctor. The doctor said, try some Lomotil. It'll plug up an elephant. Well, it didn't plug up her problem. So she tripled up and doubled up on Lomotil. It's a semi-narcotic. So she went to the doctor and said, look, I'm losing weight, I'm desperate, you've got to do something. If you don't do something, I'm going to change doctors. Well, and this doctor's thinking, good luck in Canada if you can find a doctor. So anyway, I said, I tell you what, there's a new antibiotic called ceftriaxone on the market. It's new. I want to check your liver, I want to check your kidneys, I want to check your white cells and urinalysis to make sure there's no side effects of ceftriaxone. So she said, oh, fine, I'm going to get rid of this 8:15 diarrhea. 3 germs in her stomach. One came from Germany. He said, you know, I'm really scared. A lot of my relatives were killed with ceftriaxone. I'm going to go into her longest hair and become a little cyst. And by the time it penetrates the hair, I'll be able to laugh at it. And the second guy says, I'm from Denver, Colorado. And it killed a lot of my relatives. So I'm going to go into her earwax, the center of her earwax, and by the time the antibiotic penetrates, I'll be able to laugh at it. The third guy didn't say anything for the longest time. Finally, he said, you know what? You guys can hang around here, but I'm taking the 8:15 out here tomorrow morning. On that note, thank you for coming and thank you for listening.